The blood pressure at its worst before the study was at the stages where it was reaching 240 over 120, averaging around about the 190 over 114, but it just getting higher and higher as the problem got longer and longer, and the longer I had the higher blood pressure, it just kept increasing up.
Resistant hypertension means that the high blood pressure doesn't respond to treatment, drug treatment, well, and remains at higher than satisfactory levels. And about 10% of people with hypertension are said to have resistant hypertension.
Symptoms for my high blood pressure started off in the early stages. I was on 2 tablets, and then as the blood pressure got higher, the doctor kept increasing a different type of tablet, and in the finish I was on 7 different types of tablets to treat my high blood pressure, and they in the finish were not coping. I wasn't coping with any of those tablets, and it just got to the stage it was uncontrollable. One of the reasons that I know I'm getting high blood pressure is I get the stage where sometimes the headaches start. They're the first indications, and you get sore eyes, but the headaches get the stage where the higher the blood pressure goes up, and I know when it's up around over 200, because it just gets to the stage the head's going to explode.
Renal denervation refers to causing damage to the nerves which run from the kidneys to the brain, and which play a major role in the cause of high blood pressure. So the idea of the surround sound from Kona is that there can be damage to these nerves using ultrasound, and completely non-invasive, so we don't have to puncture any arteries, we don't have to invade the body, we don't have to use radiation, so it's entirely non-invasive. Like, we don't carry out the procedure in a theatre, it can be done in any office, for instance. And how it is done is that ultrasound, different from diagnostic ultrasound, it's completely different energy than diagnostic ultrasound, and so that the energy from the ultrasound heats up the tissue around the renal arteries and damages the nerves there, and that's how renal denervation is achieved.
When I came up to do the actual have the procedure done, it was we went from the ward into a room. It was just like going into the ward itself, and they had this bed that was specially designed to do it. It was raised, and you climbed up onto it, and they worked from underneath you with the equipment. It was absolutely incredible, and the whole time they explained what they were going to do.
The procedure we have been doing recently is just in an ordinary room, not in a theatre, and the patient lies on a bed, and the ultrasound comes up from a transducer below the bed but held against the skin. The procedure will take about an hour.
But after about 10 days, I was also no high blood pressures. I didn't have any headaches come back on, and I went to my doctor for a checkup a fortnight later, and for some other procedures, and my blood pressure was right back down to normal, and there's only once since 7 weeks of the procedure that I've had a blood pressure over 150. It's just been absolutely incredible.
The first morning I seen Ray after the procedure done, I went up about 9 o'clock in the morning. I just stood in the doorway and went, wow. And he said, what's the matter? And I said, you look so different. I said, all that pain's gone off your face, you've got your colour back. I just couldn't get over the amazing difference just overnight. You know, it was like a new Ray.
We are looking for patients for this study, and of course, as part of a study, they won't have to pay for anything. The patients are those who have systolic blood pressure over 160 millimeters of mercury, and who are on 3 or more antihypertensive medications. And it's entirely non-invasive, and there don't seem to be any side effect or permanent side effects. So you would wonder why you wouldn't try it if you had high blood pressure.
I just like people out there that have got high blood pressure, talk to their doctor, inquire about this procedure, about the Kona therapy procedure. Don't give up when your doctor says there's nothing you can do, because there's people here that can make your life, it's a complete life changer, new life. I just feel so great, it's just wonderful. People in the street say to me, what have you been taking lately? You look so well, and can we have some of that? It's no.